We do have a caller on hold, so we're going to go to the phone lines where Diane's waiting for us. Hi, Diane. Do you have a question you'd like to share? Diane, are you still there?
Hi, yeah. Yes. I'd like to know what procedures I'd like to know what the procedures that you go through to have take care of a double chin, and if it's a outpatient.
Sure. Good question. Double chins are fairly easy to take care of. It's an incision that typically, if there's really a lot of extra skin, will come in front of the ear and then behind, kind of like a facelift. And in doing that, we can sort of tighten the skin and also tighten the muscle, so you might have a small incision under your chin. It is an outpatient procedure. I typically do those under general anesthetic, although they can be done in some cases with sedation and numbing medicine. And you do couple that sometimes with a little bit of liposuction just for contouring. But it's a very good operation.
Thanks for your call. Do you have any follow-up questions to that? Or are you gone? Okay. In regards to the procedures that we were talking about and the decision-making that goes into it, because it is a major decision to go with body contouring after the major weight loss, when you're talking to the patient, and we talked about perhaps the psychological profile and the dedication that they're going to entail to changing their lifestyle after the fact, the dedication to making some significant changes into how they live their lives. What are some recommendations that you give to people in regards to, you know, I've done all of this, but now here's what you need to do to keep it looking like this?
Right. Well, first and foremost, they need to maintain their weight. They need to sort of stay on the program that they've gotten on. I think all of us probably should keep a diary of what we eat and drink, because we'd be amazed at what kind of slips in throughout the course of the day. And they need to be dedicated to a good exercise program. You sort of can't get one without the other and expect to achieve or maintain. A lot of the folks that I do see really have adopted that. I mean, their lifestyles have really changed. And hopefully some of them are kind of out there passing their religion on, so to speak, to their friends and family to get them to sort of eat a little healthier and do a little more exercising. But for the most part, I think people who really are not looking for the quick fix, this is perfect. Okay, I mean, they've done the surgery, which in some ways is a quick fix. In many ways it's not. I mean, it's a lot to go through that. It has a fair complication rate in itself, although better with the laparoscopic approaches. But they need to understand that nothing happens overnight, and it is a process, and a lot of these procedures we stage. So I've had some patients from start to finish, it's been a 2-year process. And you sort of feel like you've really done something with those folks to help them, and they're generally very appreciative.
After major weight loss of this type, and then having the body contouring done for the skin tightening, I would imagine that there's so much more increased mobility to the patient's life from where they were prior to losing all of that weight and prior to getting the skin removed. You mentioned all the complications that can be brought about by the skin rubbing against each other prior to its removal.
It's amazing how mobile some of these folks are when they're heavy. I mean, they just sort of, it takes a lot of strong muscles to move around some of that mass. But yeah, they accommodate it, and then you see folks and you kind of talk to them with their clothes on, then when they take it off, you go, wow, you know, it's like you're wearing a whole nother suit underneath that of your skin. And it can be very irritating. You know, it's a little frustrating for me as a surgeon knowing what I can do, but yet having some of the limitations of what the insurance folks will let us do, or what financially some of these folks can afford to do. But I think if you plan, and if folks, you know, if it's important to them, they'll sort of make it possible. They'll save for it, like we do all things in life that we want that are worthwhile. It is you make a savings plan, you work towards it, that's your goal, and in the end, I think these are happy folks.
We have more graphics to show where you left off, if we could pick back up.
Here's someone who's, unlike the first case, which was pretty dramatic, we still see that extra roll there on the left, just sort of some general laxity, and I can kind of tell the patient's sort of sucking in their gut here a little bit. And here we see post-op, and this scar is a little uneven but pretty good. And here we see this goes all the way around the back, what we would call a circumferential abdominoplasty. And with that, you can see how the hips are tightened up nicely, and the waist is a little more succinct. So a lot of these, you know, makes a difference. Here we see someone's leg who, this is tough one, the inner thigh, the skin's so lax and so loose, you see all the rolls around the knee. And here we are having to take a scar that goes in the groin crease and then all the way down to just below the knee to really tighten that. And even when you're done, if you look at this next patient, as much improvement as we've made, you're still going to have some laxity, you're still going to have some wrinkles and rolls. A lot of these folks, even at their thinnest, are still not super thin folks. They still carry a little bit of insulation, and to me these are outstanding results. And this arm, of course, this is just a home run waiting to happen. No matter what you do for a patient like this, you're really going to make them better off. All this extra skin, it's just to get rid of that's just a tremendous thrill for everybody in the OR. Now, the one thing that sort of happens not infrequently and perhaps on a monthly basis is we get a call at the burn unit. These folks say, hey, I've lost a bunch of skin. If I donate my skin, can I get the surgery paid for? And as much as I'd like to do that, they actually won't take the skin for skin grafts for like burn patients. You have to have essentially a whole body's worth, I think, for the skin bank folks to have it be a worthwhile endeavor for them. There was some research going on with some of the fat cells we removed, a company out of Warsaw that we're ongoing with, but that's not something that's sort of reimbursed for folks. It's you just donate in the name of science.
And so in regards to being able to donate skin, it's only on a cadaver basis then? Is that what we're...
It's just there's a certain expense in processing the skin and testing it for all the things that skin can carry that unless you're getting enough of it they tell me that it's not a worthwhile endeavor for although a lot, but the little bit that you get from these folks. So there is a limit. And the other thing that people think is, well, I've got all this loose skin, I'm going to lose another 50 pounds here. And it's amazing how little just skin weighs. So even in that first case, which is so big, I'd be surprised if more than 10-15 pounds of extra skin came off.
In regards to under some criteria when insurance companies might cover it, I know you said that that's something that they really examine closely and kind of you have to meet all these criteria. What might some of those criteria be where sometimes they might say yes?
Sure. That's something you can start early with. A lot of times you work with your family doctor, your internist, where you have these chronic rashes, you document it. You know, one of the double-edged swords that I see is patients that are really fastidious in their hygiene and their care. They may shower 3-4 times a day and use powders and gauze, and I mean just really go to great extent. They don't get rashes. Then you get someone who's a little less sort of careful about their hygiene, may or may not shower every day, show up with these tremendous rashes, and these folks get it approved. So whenever those rashes do come up, document it with your family doctor, or have someone, because a lot of times there's some treatments that are a little more efficient than what you can buy at the drugstore. You just need to document. And another doctor other than me sending a letter saying they think this is worthwhile, it really can be helpful.
In regards to the different aspects of the procedure, a lot of women seem to have the complication more so than men of cellulose on the backs of their legs, and it's a big concern, and weight gain picking up in those locations. And even separate from major weight loss, those issues are sometimes there where they're just not satisfied with the dimpling and the shape of the backs of their legs and things along those lines. What are some of the major complaints that you're hearing in regards to some of the photographs that you showed, and what can be done about those issues?
Well, I think most of these folks actually, they sort of say, I'm really happy, but, okay? And the but has to do with where you transition from where you operated to where you didn't. Because for a lot of these folks, I could continue top to bottom and side to side and still work out extra skin, but at some point you sort of stop. So it's looking at those interfaces where they say, okay, what else can we do? Or I tell folks I'm doing these big hip lifts and thigh lifts, lower body lifts, it's called, that you're going to re-stretch because your skin's already proven it can stretch. It's already been stretched out. As tight as I can pull it today, it's still going to stretch some more. So it wouldn't be uncommon to sort of do a secondary touch-up, re-stretching on the hips particularly, because you carry a lot of weight on the sides. And that's probably the area I see the most revisions on. The other thing might be some of the irregularities of the scar from one side to the other. It's really hard to draw that line and keep it at sort of the same level. But at the same time, you have different tension forces pulling from top to bottom, and both sides of your body may pull a little differently, so we do see a little scar displacement from that.